Well, chest pain can be something that may trick you into thinking something else is going on in your body, specifically maybe something wrong with your heart. But here to break down the causes of chest pain is Dr. Shoba. Dr. Shoba, as always, so good to see you. So we want to make sure that we really kind of describe the difference between, you know, heart pain and chest pain, and that there is a difference between the two.
That is right. You know, of course, one of the biggest killers in the world is, you know, heart attacks.
Right.
So we want to be sure that it's, you know, you're not missing a heart attack as the most important cause of your chest pain. But beyond a heart attack, there are so many other causes of chest pain that we need to be aware of.
Right.
And watchful of.
And this is if you go into your doctor and your doctor says, your heart is fine, your heart is healthy, but maybe you're feeling chest pains that you're wondering, where is this coming from, right?
Right. And what I would like to do is divide it into two big categories. One of the more dangerous causes of chest pain that are not necessarily the heart, and more of the garden variety day-to-day chest pains that we have. So when we talk about the big killers, one of them is the heart attack, but the second one is a dissection, or the aortic dissection, where you have a tear in the lining of your aorta, and that can kill people in a hurry, and that you have severe pain going through and through to your back. One of them is a collapsed lung. You know, you're a smoker, you've got all these what we call blebs in your lung, and that suddenly bursts and then it presses on your heart. That also causes a lot of chest pain. And one of the biggest killers is actually a blood clot to the lung. Actually, the other day we had a lady that came over to Sycamore Shoals. She had fractured her leg after falling, and then shortly they fixed her leg and everything. She went home, and then all of a sudden she started having a lot of chest pain. She became very cold and clammy, and they thought it's classic heart attack. Sent her to the emergency room at Sycamore Shoals Hospital, where I got a call, and I said, wait a minute, she just had surgery, she's never had heart trouble, doesn't have all the risk factors. Why don't we check her for a blood clot to the lung? And lo and behold, she had a blood clot in the lung, and that can be as dangerous and as big of a killer as a heart attack. So now let's come to the more garden variety chest pains that we have on a date. And you know, oftentimes we don't pay attention to our bodies.
Right.
But you know, all of us have fleeting chest pains here and there. We have these occasional flip-flops in our heart and the chest pain that goes with it. So you can have rhythm problems that can cause chest pain. Stress is a very big cause of chest pain, and stress works in 2 or 3 different ways. Your blood pressure goes sky high, you have spasm in the arteries of your heart, and then on top of it, if you're drinking a lot of caffeine to stay up, or if you're a smoker, that adds to the spasm, and that can cause severe chest pain. Now, when you do procedures for the heart, like a stress test or a heart cath, you may not find any blockages, but controlling your blood pressure helps. You know, the other day I had a lady came into the emergency room, severe chest pain. Again, I got called in. Well, her blood pressure is 200 over 100. Well, guess what? For the last few days, she had been eating a lot of food that had a lot of salt in them. And she had been missing her fluid medications. You know, she'd been salting her watermelon, she had been salting her tomatoes. You know, summer is a good time to salt stuff.
Right.
You know, a lot of popcorn, potato chips, a lot of friend and family. Blood pressure was through the roof, and she had chest pain. And so if you just think of small things that you might have done that cause you to have chest pain, or did you eat, if you're very sensitive to caffeine and you have eaten a big chocolate cake or chocolate pie, pudding, you know, that kind of thing, and your blood pressure is high now, you're going to have chest pain just from that. Reflux, think about that, gastroesophageal reflux disease and esophageal spasm. If you're popping a lot of ibuprofen medications for joint pains, it's going to really eat up the lining of your esophagus, and you're going to have a lot of chest pain from GERD.
Really? Just from the GI tract? I would have known that there would have been that kind of relationship between the GI issues and chest pain as well. And there's also some other ones, including the gallbladder and other things as well.
That's right. You know, we've had people who've come in with a heart attack, and what we find in the end is they actually are having a gallbladder issue. They've got a stone stuck in the mouth of the gallbladder, or they've got a lot of inflammation in the gallbladder, and getting rid of the gallbladder takes care of all their chest pain.
Wow, that is so interesting. And you know, you mentioned stress and high blood pressure. I think a lot of things, you know, we always talk about lowering your stress levels, how important that is, and lowering your high blood pressure. So obviously it has an effect on not just your heart, but other issues in your body as well, right?
Oh, one thing I do want to mention, in the older ladies that have these arthritis-like pains, there's a condition called costochondritis, which is an inflammation in this joint right up in there that sits right above the heart, and it's very sore to touch, and that is the key difference, is whenever you touch that area, it hurts. And some of these chest pains that hurt when you take a deep breath in could be because of an inflammation. We used to call that pleurisy in the olden times, you know, inflammation in the lining of the lungs or in the lining of the heart. You've got pneumonia, something like that. That'll cause a lot of chest pain. You know, even at rest, when you take a deep breath in, or when you things like that.
Right. Very interesting. Thank you so much for coming in. And we always want to say, make sure you go talk to your doctor if you know if you are experiencing any of the things that you've heard Dr. Shoba talk about today. We always appreciate you coming in, and make sure you check out www.heart.org for more information.